The headliners, the newsmakers, the political scene, and government issues. These should be our concern. And we're taking you at the forefront. Good morning. I am Attorney Karen Jimeno. Join me at the forefront as we discuss the details of national issues that our country faces. Independent health reform advocate Dr. Anthony Leachon has been voicing his opposition on the decision of the Finance Department to transfer unutilized PhilHealth funds. Dr. Leachon appears to be waging a lonely battle for the PhilHealth Fund, as even Health Secretary Ted Herbosa is not opposing the fund transfer. Joining us is health reform advocate and social media influencer, Dr. Anthony Leachon. Good morning, Dr. Tony.
Good morning, Attorney Karen.
Let's talk about first the PhilHealth Fund. So why are you opposing the transfer of unutilized PhilHealth funds?
Well, when I attended the first hearings led by the Senate Committee on Health, I was the one to present against of course, the proposal I remember during the time there was Secretary Recto, Secretary Herbosa, the DBM Secretary Mina, and the President Emmanuel Ledesma. And during that time, the senators who were present at that time, Senator Bongo, Senator Risa Ontiveros, and then Senator JV, and then Senator Rafi Tulfo, and Senator Bato de la Rosa. I articulated three things. The first one, it's unconstitutional because the Universal Health Care Law, which is RA 11223, would say that funds for health, let's say universal health care funds, should only be earmarked for health and nothing else. And you will only achieve three things. The first one, you need the funds to increase the benefits. So you reduce the out-of-pocket expenditures of every Filipino. The second is to reduce the contribution or the premium rates that we pay, kaltas sa salary. And then the third one is to realize the Universal Health Care Law signed by President Duterte in February of 2019. So, backtrack. In 2012, during the presidency of Aquino, na-hatch yung kalusugang pangkalahatan, so otherwise known as Universal Healthcare. And I was appointed as a 1 peso consultant by Secretary Ona to address this. So yung sin tax law, which would increase the taxes for tobacco and alcohol, and now including vape and sodas, the tax generated will go to PhilHealth to finance non-communicable diseases or lifestyle diseases. In essence, we will reduce the burden. Now, in 2016, I was appointed as an independent director of PhilHealth, basically representing the Monetary Board, head of two committees, risk management and audit, basically to protect the funds for the government, for the sin taxes. Yun ang trabaho ko. And my last day was the signing of the Universal Healthcare in 2019. So what I'm saying, it is unconstitutional. Two, it is illegal. I'm not a lawyer, but based on discussion with the Syntax Coalition lawyers, it's a form of technical malversation. Because pera yun ng PhilHealth, hindi mo siya pwedeng ilipat for bridges, buildings related to DPWH projects. And the last one, which I think more painful, is actually immoral. Kasi people right now are suffering when you're in the hospital, lining up, magpapa-admit sila, and then after that, magdi-discharge against advice. Ang iba hindi na nakakapunta sa ospital. I have 2 patients na practically nag-suicide. Why? pareho sila nagda-dialysis and they have 2 kids na college. So sabi ng father, I'd rather not undergo dialysis so that the money that will be spent will actually for the education. So parang, depressed and everything kasi yun ang problema. The other one, so after after the father died, 3 years after, tapos na ng college, the mother naman sunod kasi 53. I don't want to spend your salaries for a lifetime problem for the next 20 years. So basically ganun. And then the story naman, a pregnant woman and a baby in Cebu died on the streets because ang sabi niya, wala siyang pera for hospitalization. So
But that could have been covered by PhilHealth.
That could have been covered by PhilHealth.
Even if you don't have contributions.
Yeah, because there are 2 ways of getting contribution. You have the direct contribution deducted for any employee working, of course, in the workplace. And the other one, indirect. Indirect, ang ibig sabihin nun, one, indigents. And this is actually in coordination with the SWD, listahanan, so they have that. 2, disabled, your PWD. And number 3, senior citizen not gainfully employed. So these are the sinasabi nilang subsidies. But the government is saying, ang kukunin lang daw nila yung government subsidies. Pero social insurance kasi siya.
So Doc Tony, let's take a step back. What is the government trying to do here? The Department of Finance is trying to take unutilized PhilHealth funds and transfer it to where?
To unprogrammed appropriations.
So is it going to go to any specific government agency or where will the money go?
Well, ang nakalagay doon, mga foreign assisted projects, 1, DPWH projects, tulay, bridges, buildings, access to universal healthcare daw, right? So yun ang nakalagay doon. So it's based on the circular 003-224 issued by Secretary Recto, right? And then the money, 89.9 billion, may time of remittances. Kasi during the Senate hearing, I was actually near the screen, and when he was presenting, nakita ko yung timelines. So na-remit na pala May. And then, so the presentation during the time, July 30, on my birthday. And then, nag-file ng Supreme Court petition, Senator Coco Pimentel, former USEC Chelo Magno, Dr. Mingita Padilla, the Philippine Medical Association, for a TRO, and of course, return of the funds na nakuha na. Pero despite that, August 2 yun, August 21, niremit pa rin. Kasi I was in the Senate August 20, and Senator Bongo asked the President of PhilHealth whether he would remit pa rin despite a pending Supreme Court petition. Kung hindi utusan ng Supreme Court, re-remit na natin. But then October 16, 30 billion, and then November, another 30 billion.
So this was all going on last year, and now we have budget season.
Here, 2024.
But you're talking about October.
October this year.
You mean the October this coming year would be another remittance?
30 billion to a total of 90 billion.
Okay.
So May 20 billion, and then 10 billion, August 21, October 16, 30 billion, and then November 2024, another 30 billion.
So right now, this has gone to the courts. A petition has been filed with the Supreme Court questioning the constitutionality of this transfer.
Yes.
And what is the status of obtaining a TR or temporary restraining order from the court?
Well, last week, the Supreme Court said that they were mandating the Office of the Solicitor General to answer in 10 non-extendable days. And siguro after that, they should meet and bank. Ang problem lang, October 16, i-remit na naman yun unless the Supreme Court intervenes.
So in the past, Doc Tony, 2013, when Senator Risa Ontiveros was still a PhilHealth official, she declared around 163 million pesos as bonuses to PhilHealth employees, and she was criticized for this. And then in 2020, there was a whole scandal on an anti-fraud employee of PhilHealth disclosing that 15 billion pesos went to some PhilHealth officials. So in the past, it seems like there's also a track record of either misappropriating or using unutilized funds of the PhilHealth. So how would you address concerns that if this also stays within PhilHealth, it would also be either misused or misappropriated?
Well, that's a solid sign or symbol of ineffective leadership of the chairman of the board, Secretary Ted Herbosa, and the president, Emmanuel Ledesma. So during the time when I think for the last administration, there were 6 presidents na naghawak ng PhilHealth. Imagine mo yan. So ibig sabihin, ang problem natin would be secondary to the appointment of the PhilHealth president and also the one managing it. Kasi what's happening right now, forgive me for saying this, who were appointed before sa mga PhilHealth president, people na not related to the medical field. With due respect, General Morales, NBI Director Dante Gueran, and then right now the current president, non-medical din siya, coming from the energy sector, right? And then supposedly the chairman of the board, Secretary Herbosa, should have protected the PhilHealth funds in one interview, and of course the pronouncements na he's not opposing the transfer. Eh dapat nga ino-oppose niya as the vanguard of the funds ng PhilHealth for the entire Filipino. So, it's a big disappointment for all of us Kasi, kunyari, ng heart attack ka, 1 million ang bill mo. You know how much PhilHealth lang babayaran? 30,000. With the 90 billion pala, you should have, pwede pala mag-angiogram ka, pwede ka na mag-bypass. Kung may cancer ka, even the PET scan, the MRI scan, pwedeng bayaran yan. Kung ikaw ay na-stroke, how much is one ICU per day? 50,000 per day. Magkano ngayon ang dialysis? Okay nga. Pero wala ka naman preventive arm. So dapat meron na tayong PhilHealth outpatient card that we can actually determine our laboratories. Kasi nagugulat na lang tayo. We're diabetic na pala, our creatinine, the kidney function test, deranged na. Ito, nagdadialysis ka na. So by this time, dapat may outpatient packages ka, dental privileges. All of these things, they should have done that. Pero ito ang very treacherous They said wala silang money. And then, they said, nag-increase sila ng premium last January from 4 to 5%. Nag-increase sila, yung pala, meron silang pondo. Tapos, Pebrero, sinabi nila may excess funds through a letter of Secretary Recto to Ledesma based daw on their discussion at the cabinet meeting, they would remit the 89.9 excess funds. And then, verbatim, I would like to quote that particular letter, to be used for infrastructure and social economic programs for the national government. So, that is unconstitutional kasi naka-earmark yan Ngayon, ang defense nila, during the bicameral meeting of December 2023, hindi natin alam because alam mo naman, hindi yan televised just like any other budget hearing. That's the third chamber na tinatawag Nagkaroon ng insertions for the Congress, the Senate, and then for DPWH project. Then they inserted a rider provision that any excess funds, idle funds, right, pwede daw nilang kunin yun. And then they got the COA permission, the OGCC legal opinion, but you can actually not supersede a Republic Act.
Yes, a law. So
A law.
right now, we're waiting for the Supreme Court to decide the constitutionality of this. But some of the former finance secretaries also defended this act and are supporting the decision of Secretary Recto. They're saying that it's better to use unutilized funds instead of taking a loan or having a deficit in our budget. What would you say to this?
Well, Secretary of Health din, dinidefend din yung position namin. It's like circling the wagons right now, di ba? So you have to get your allies in order to protect you. But sa akin, as a Filipino, they have the opinions on finance. Why will finance meddle with the health when there's a huge health problem? Mabuti sana if the excess funds, kunin nila kung okay naman tayo sa universal healthcare. Yung walang namamatay sa kalye, walang pumipila sa PGH, wala kang hihingi ng guarantee letter, pipila ka everyday. Hindi ka Pilipino, Karen, kung nahospital ang anak mo na hindi ka nagtitiis, nangungutang ka, at nag-aalala ka, at iiyak ka.
So, Doc Tony, here's something I'm concerned about. So even for me, when I get my salary, there's an automatic deduction for PhilHealth contributions. And I think a lot of Filipinos can relate to that, na may kaltas agad. But you're saying right now that that fund should have been sufficient, considering there are unutilized funds, to cover a lot of the health benefits that we should be enjoying. Because for me, when I get sick, I don't even exert the effort to claim from PhilHealth because they make it so difficult to claim, or it's a bit complicated, the whole process. So if we are able to allocate these unutilized funds for the members of PhilHealth, do you think there's sufficient funding to increase the benefits? Or
Yeah.
at least to channel it to bureaucratic improvements to make claiming easier?
Exactly. Yeah. Alam mo, when we were crafting universal healthcare law, when I was at PhilHealth, ang projections in 10 years, the out-of-pocket expenses natin, Karen, should be around mga 10 or 20%. On the 5th year na, though nasnag tayo because of the COVID pandemic, but you have excess funds, 5 years na, 2019, 2024, dapat yan, mga 30% na lang ang out-of-pocket expenses natin. Let's say, let me give you an example. During the COVID pandemic, ang case rate is 700,000 pesos. Ibig sabihin, di mo kailangan mag-down . You have an excess funds right now. Kaya nakikita natin na dapat nagawa nila yan. How we will do that? Well, kulang sila kasi ng actuarial analyst . That's number one. Competent doctors na pwedeng gumawa ng mga packages yan. Kung hindi na kaya, you have many experts to do that .
So there's really a lot of areas that can be improved if we were to use these funds. And for example, if the allocation to infrastructure and the other unprogrammed funds of the PhilHealth unutilized funds disappears, meaning nagamit na siya and then suddenly PhilHealth requires this money, who will be endangered by that appropriation?
Well, the Filipino people will be endangered. Kasi sa basic human right ako every day, my only concern as a father is actually health and education. That's the human capital . I remember, absent lang ako sa work kung may sakit ako, may sakit mga anak ko. So to me, importante yon. So who will suffer here? Filipino people. Tsaka, this will be a precedent . So ibig sabihin, the PhilHealth will be a milking cow later on if the Supreme Court will not issue a TRO or will prevent the further transfer. Magiging milking cow ang PhilHealth from here on. So ano pang gana mo mag-contribute,
Yes.
di ba?
Yeah.
Ba't ka pa magko-contribute? Wala ka naman palang mapapala dito. So, that's the problem that we are facing.
Okay, Doc Tony, we're gonna now shift to you as a person. So last year, you were appointed as Special Advisor for Non-Communicable Diseases by Health Secretary Ted Herbosa. But after a few months, you resigned right away. Can you tell us why you resigned? But before you answer that question, we'll have to take a short break. At the forefront, we'll be right back. Welcome back at the forefront. Doc, we were discussing earlier before the break. Last year, you were appointed as Special Advisor for Non-Communicable Diseases by Health Secretary Ted Herbosa, but you resigned immediately a few months after. Why did you resign?
Well, I was alerted by a physician after watching the budget hearing for the Department of Health. And of course, a congressman, a previous health secretary, questioned why Secretary Ted Herbosa appointed me as a non-communicable disease special advisor to the Department of Health, na hindi naman ako expert. So, you know, without defending me with a slight nudge lang, hindi man lang niya ako na-recall. Well, modesty aside, I served 4 presidents. I was one of the leaders of the sin tax law. And I was appointed PhilHealth Director. I worked with him in 2012 when he was USEC for Secretary Ona. And during the pandemic, 1 week into the pandemic, I was summoned by the palace to serve as a National Task Force Advisor with Ted Herbosa, reporting to General Galvez. So these are appointments by the President.
Yeah. So you are clearly also an expert, like you have that background to be considered an expert in medicine. But
I resigned, and I'll tell you the main reason. So when I got home that day from Secretary Herbosa, then he said to me in the office niya, wala napilitan lang ako kasi I was being forced by Secretary Garid kasi yung budget hindi a-approvean ganun ba? Sabi ko sa kanya. So I went home, I talked to my wife, and ang daughter ko nga nandun Ang sabi ko, I will resign. Gusto ko lang yung exit namin maganda. Kasi I don't want to work under a spineless leader and a person without moral courage. I cannot work under that. So I resigned. And kunyari later on, I would actually propose, let's say, medical cannabis. Against ako dyan, pumapayag siya. Tobacco. Hindi ko naman proposal yan Proposal ni Tony Leachon yan So later on, ako maiipit. And then the blame game again. Like yun, ang bine-blame niya ngayon, kaya daw yung PhilHealth, ganyan, nag-excess. Kasi kasalanan ni Ledesma yan I don't want like that. So sabi ko, I'd rather work as an independent health reform advocate rather than work under a spineless, under someone without moral courage, someone with, integrity and honesty that can protect the Filipino people. My career, lagi akong ganyan I resigned as well during the time of Secretary Ona kasi hindi ako pumapayag din sa stem cell noon. I resigned din sa National COVID as an advisor because I think there were certain differences in terms of communication to the public with transparency and integrity regarding the data of the COVID pandemic, as well as the deployment of the vaccines and everything. So, ganun lang. Straight arrow lang naman ako And ngayon ko lang sasabihin why I resigned. And that's the true story. And I did not apply for the job. I was invited to help, and to add value. I have a peaceful life. So, hindi ko kailangan yan.
Doc Tony, you mentioned a congressperson, that was a former health secretary, and that the only person I know that fits that description is Secretary Garin, who you also mentioned just now. So she chided that Secretary Ted Herbosa was hiring non-experts. Is there anything personal between you and Secretary Garin?
Well, I testified during the Senate hearing sa Blue Ribbon during the time of Senator Dick Gordon. And together with Dr. Tony Dance, Inday Dance, and Professor Mary Ann Lansang. And during the time, as a pharmaceutical medicine expert, because I worked in the corporate world before, I know how it is. So we think there was a, of course in the courts right now, after Ombudsman, RTC, right now it's in the Sandigan Bayan. So hopefully it's not a sub judice. But just for clarity, I said during the, and it's in the public right now, that there was a premature approval of the certificate of product registration because the safety trials were not...
For which, what are we talking about?
For the drug Dengvaxia.
Okay.
And then it was approved on December 22 of 2015. And when they ordered the vaccine, it was available in 1 month's time. I mean, ang bilis naman. And they injected this to school kids, to 1 million kids. And then hundreds ang namatay doon. And then, after 1 year, the global Sanofi announced that this particular drug is only in, after the, of course, paglabas ng trials, it will only be used kung na-expose ka na to dengue, that's seropositive, and it cannot be used for seronegative. Eh lahat yun, pinagbibigyan nila without even pre-testing whether the patient was exposed to dengue, not even a history. At anong, dapat yun, doctor-assisted din. Eh, ang nagbigay lang, mga nurses lang sa mga schools. Eh, a product yun. And then, that product should not be in the national formulary kasi hindi naman siya emergency drug eh. A drug na launched into the market should be in the market first for 1 year. It should not be in the national drug formulary kasi kalo-launch lang siya. Now, if it is proven and safe, a-apply ka in the PNDF. And who's the head of the PNDF? That's Secretary Garin. And who's actually overseeing the FDA? Diba? It's also the Secretary of Health. So dapat, in the next Congress, dapat autonomous dapat ang FDA, like in the US. Diba? Ang Department of Health. And then, hindi na rin dapat ang PhilHealth under the Department of Health. Kasi it's a finance institution eh. Eh, nandun siya as chairman of the board, hindi rin na niya na-protect ang PhilHealth. So, dapat autonomous siya so that wala silang control or influence in these agencies that may jeopardize the Filipino health.
Doc Tony, it sounds like there are serious liabilities with the Dengvaxia vaccine, considering that you mentioned there were hundreds of kids that also died as a result of the Dengvaxia. How is the status of the case right now? Are you aware as to whether there's already a decision that's going to come out soon?
Well, it's right now in the Sandigan Bayan. And I was alerted na siguro hearing will be soon, no? Kasi matagal na, since 2016. 8 years na. And, you know naman, the justice system in the Philippines is quite slow. But we'll be ready. Kasi consistent lang naman yan with all my pronouncements sa Senate, sa lower house, and even at the regional trial court in Quezon City. So ganun lang yun. I will be ready.
You mentioned earlier that you also resigned from being an advisor to the anti-COVID task force in the previous administration. There were some people said that you were considered or perceived to be an alarmist. Would you say that this was also a reason why you left? because there were some reports that said that you were perceived to be an alarmist. That's why President Duterte also asked that you leave the anti-COVID task force.
That was not true. Yung alarmist kasi, when you're in a situation of emergency, as a doctor, I'm an internist, I work in the hospital, day in and day, I see deaths every day. You cannot be political about this. It emanated from a visit in Cebu because of the request of some doctors there. So, anong nangyari nun, nakita namin ang situation na the hospital pala filled up to the rafters and there are many deaths. But, the provincial government, as well as some businessmen, were trying to influence the decision-making. And there were many people. So, I was advised then na we should not tell this. Ako hindi ko matiis yun. Right there and then, I tweeted that there were many deaths in Cebu. And 2 days after, I was asked to resign. But I was vindicated because General Simatu went to Cebu, if you remember. And then nagpa-ECQ siya with tanks there because people were nandun lahat. Sino mali ngayon? Kasi you have to tell the people. Kasi ang problema, when politics and business nandun, to influence whether there should be lockdown or not, hindi naman pwede yun. If people are dying and mataas ang cases natin, then we should alarm the people so that the people will not be hurt. During that time, wala pa tayong bakuna. Diba? So, ang problema ko, I cannot take that. Kasi nangyayari, nagkaroon ng ginagawa yung COVID into a political situation. You manage the communication, you manage it, so that you feel, it's not like that. People are dying. Ngayon, the other one is the vaccination. Imagine mo yung vaccination natin. Ilan na nasayang? 35 billion. Because of the deployment process and the choice of the vaccines then. So, whatever it is. And then, the family scandal. So, I was also, during the time, a witness during the Blue Ribbon Committee. After that. And then, after that, recently, a former Secretary of Health said na talagang may problema. You know all these things, lumalabas na eh. What I'm saying, I'm not an alarmist. I'm always on the side of people. Ang tawag doon, proactiveness. Visionary ka dapat so that you can anticipate problems bago pa mangyari yun.
With right now the world facing Mpox as a new possible threat, do you think that the Philippines is ready to face Mpox based on what we've learned from our experience with COVID-19? But before you answer that question, Secretary Doc Tony, let's take a short break. At the Forefront, we'll be right back. Welcome back at the Forefront. Doc Tony, before the break, we were asking you, because you talked about the experiences we had with COVID-19 pandemic. Right now, the world is facing Mpox as a new threat. Do you think the Philippines is ready in case Mpox becomes widespread?
I think we're ready because of our experiences in the COVID pandemic. And just for clarity lang for the audience, the World Health Organization announced it is a public health emergency of international concern because of an outbreak in Congo, West and Central Africa, in some countries. They're doing that proactively, I think, so that we will take precautions, educate people, hasten up research, and if there's a need for vaccine deployment later on, ready na ang mga tao. And I think that's the essence of that PHEIC. Today, we have 5 cases. Iba ito with the COVID. The COVID kasi, iba ang transmission yan eh. Anything eh, di ba? This one is
close human contact?
Close human contact, kissing, and of course, sex, utensils, no, sharing. No? So, mahirap mahawa yan. So, ibig sabihin, washing of hands lang, and then, of course, the regular minimum public health standard must still be protected. So, to the audience, don't panic. This can be managed. I think we learn enough. I think we're educated, empowered. No? Basta lahat tayo right now, balik lang tayo to the minimum public health standards, we will be okay. So what is important lang is to be morally and socially responsible. Kung meron kayong symptoms referable to the MPOX, report natin sa Department of Health para mag-genomic studies kayo so that we can actually protect more people. Pero to panic, lockdown, no.
Okay, that's great to hear, Doc Tony. Well, now in Congress, there's also a bill pending on allowing the use of medical marijuana. What is your position on this?
Well, I was called several times sa Senate 2 years ago, and then last year, I was part of the technical working group. Ang concern ko niyan, as a I'm speaking right now on behalf of the Philippine Medical Association, 100,000 doctors. Ang una niyan, it is only indicated for one small indication, yung pediatric seizures, right? Okay, that's the only one. Number two, marami siyang adverse events na pwedeng mangyari sa atin. Ang tingin ko, tataas ang crimes. Ang tingin ko, the potential for abuse. Number three, it is still under the PDEA at saka Dangerous Drug Board. So they have to delist it there so that makonsider nila for medical marijuana. And the third reason, which is more important, it will actually supplant or supersede the FDA. Kasi why will the Congress be right now the one to decide on a drug? Di ba kung drug ka, dapat isubmit mo for efficacy and safety test sa FDA, and then the FDA decide whether this is efficacious and safe. Di ba? And there's a route already, compassionate use. And since the market is too low, mababa siya. So, hindi mo kailangan gawin to. Kasi ang problema to, it might open the gateway for recreational marijuana. And
which you're also against.
Of course, of course. Kasi, I've been through some areas in the US na ganyan. Talagang mataas ang crime rate. So, I went to Seattle, where yung first Starbucks nandun, ano? And then, an Airbnb, nandyan yung marijuana store. Imagine, nagpa-picture lang kami after buying some souvenirs, and in 5 minutes, nawala lahat yung binibili namin. And then, yung mga stores na yan, suddenly, may nag-aaway once na nagkaroon. And every corner in Seattle, may police. So what will happen here kung lumabas yan sa market, nabibili mo online siya eh.
Yes, but Doc Tony, what about other countries where this was implemented by law? So some countries have done it in that manner as well, where they have a law that legalizes marijuana, and then I suppose the FDA comes in when the products come in so that they can authorize whether certain products really meet the standards.
Okay.
But personally, I lived in Berkeley as a student where marijuana is legal, recreational marijuana, and I don't think there's a direct correlation between crime and the legalized marijuana per se. There are other states like Colorado where this was legalized, and it even allowed the funding of laptops for students for free. So what is your
that is a very
response
good,
to that? Yeah.
That's a very good question. But because we live in the Philippines, where the problem is the lack of regulatory and police control. Ang tanong nga ni Senator Gatchalian during the Senate hearing kung shabu nga hindi natin makontrol, marijuana pa na ililegalize natin. So that's my concern as a father many magkakaroon ng plantation for the raw product. So, if you legalize that, anong pwede? Nahuli na nga sa Taguig yung nakalagay din siya sa vape products. Yung juice na yon, how would you know na nicotine yun and then ilagay dyan ay marijuana juice? People are creative eh. Kaya ang sabi ko, kung gusto nila gawing medical marijuana, only for that indication. Kaya lang, yung lawmaker, sinasabi na it can be good for cancer, it can be good for depression, whatever. Kaya lang, ay man of science eh. Kung ano lang inapruban ng science na kailangan sila, ipakita. Now, the Congress has nothing there, or even the Department of Health, magkakaroon doon ng cannabis center. But the Department of Health is not FDA. FDA, nandun yung experts to test yung mga studies yan, efficacy and safety. So, you live in Berkeley in the US. But we are in the Philippines eh. Meron nga tayong problema sa drugs. May ICC. No, darating pa. All of these things, nakikita, this is a different world na wild west. Ang daming ang produkto na hindi registered sa FDA, mabibili mo sa Quiapo, mabibili mo sa Divisoria, marami ka nabibili online. Ang daming ang fake drugs eh, using me and using other personalities. So how can you control that?
So as a man of science, you're saying that there is a distinction between marijuana and other hard drugs like shabu, for example, except that with the Philippines, it may not be regulated properly or its use may not be controlled as much compared to other countries where we've seen this work.
Let me put it this way. I'm not against medical cannabis for the indicated purpose. But the risk-benefit ratio would tell me that there will be more risk than the benefits. Ganun ang gamot eh.
Because of the external factors in the Philippines.
External
governance, our structures.
Regulatory, police control, all of these things. The potential to abuse, doon ang problema.
So that's clear, Doc Tony. What about vape? Are you in favor or against it?
Against. Because after the sin tax law, the tobacco companies shifted to vape. Ang laman din kasi nung vape, nicotine din yan. Now, sinasabi nila, harm reduction siya, pero pareho rin eh. Because ang isang cartridge yan is equivalent to 45 sticks of cigarette. That's why, a few months ago, na-diagnose na in younger individuals ang heart attack. In PGH, 22-year-old, without any risk factor except vaping, nagkaroon ng heart attack. In my clinic, 20s to 30s, meron ng heart disease, na stroke na, ang daming mga sakit. So, yan ang problema natin, and it's rampant. And then, ang problema niyan, yung law, hindi na under the FDA, di ba? DTI. So, binabalik. I don't know kung totoo yun. Number 2, they allowed yung flavored. Mga flavors na fruits and something that can entice the young ones. And then, binaba nilang age na pwedeng gumamit from 21 to 18. Immature pa ang brain nila. So, they can be easily enticed. So, sabi ko, what kind?
So, is it as addictive as
It is
regular
as
cigarette?
addictive as regular cigarette. And yan ang problema. Kasi parang Trojan horse yan eh, of the tobacco industry. So, they're using the vape right now. Pero, kasi, additional income sa kanila. Meron silang tobacco with the sin tax. Tapos ito naman vape, lower ang sin taxes because it has been marketed and positioned as a safer alternative to tobacco. But it's the same banana.
Doc Tony, I don't smoke, so this is something that I'm concerned about because I avoid cigarettes when I see it because I don't want secondhand smoke. So if I see people vaping, is it also as dangerous as the secondhand smoke you get from cigarettes?
Absolutely. Pareho lang siya. It's a white smoke. Wala siyang amoy, pareho. But the dangers is of course the same.
Okay, so do you think this should be regulated in the same way as cigarettes? And there are ordinances that prohibit smoking in certain areas, but I don't know if it's clear to people if that covers vape as well. So do you think it should be the same regulations?
It's the same regulation for smoking kasi pareho lang naman sila eh. And if we do that, the younger generation na magsasuffer sa atin kasi they're the ones eh. As young as ang statistics ngayon, 11% for the 14-year-old. Ang taas niyan. So, ibig sabihin, hindi pa man na nag-work yung mga estudyante, may sakit na sila. di ba? Imagine mo, they will have coronary artery disease, pwede sila ma-stroke, pwede sila ma-cancer. Kasi the same problems related to smoking, cancer, coronary artery disease, stroke, chronic lung disease, they will develop all of these things. So why should we allow that? Our concern should be to protect our kids and the general population. And anything that will potentially hurt our people, dapat against tayo doon.
Dr. Leachon, you're one of the few doctors in the Philippines with a large social media following. What do you see as the advantages and disadvantages of being a social media figure?
Well, I think more of the advantages eh. Kasi you can actually articulate things na nababasa mo in a faster way. Kasi dati, kailangan mo ng press con. Ngayon, just opinion. Kunyari, a media station is following you, a personal, kunyari, influencer is following you, your statement can be news the next day. A disadvantage, maraming bashers rin sa'yo. That's part of advocacy. But I'm a stoic individual eh. I can endure any kind of pain related to my work. I'm focused. I have courage. I have self-control. I think I've developed a certain kind of wisdom. And what is the most important is there's justice for everyone using science. Yun lang sa akin.
Doc Tony, have you ever been sued for libel? Because when you post or tweet or post on social media, that is always a risk, right? So have you been sued for any e-libel or cyber libel cases?
Twice, dismissed yung isa, that is with Secretary Garin. The other one against a pharma company, pero it did not progress at the NBI kasi walang probable cause. Talagang ganun eh. When you're on the side of truth and you want to protect other people, then those are certain risks. But it should not actually deter you from doing your work eh. Kasi it's a higher sense of purpose eh. I don't want to fade into the sunset without meaning at all. Memento mori, nobody lives forever. Mamamatay ka din eh. And people die day to day. And then after that, you're 1 week in the social media, makakalimutan ka na. 1 week lang shelf life niyan eh. And then I want to be remembered later on by my apo or by my anak. That's my dad. He was able to help other people during the time of the pandemic, during the greatest challenge in healthcare. Yun lang. It's maybe something na magmo-motivate sa akin day to day that I'm doing this maybe selfless in my own opinion. And that's, to me, the relevance of being a Filipino physician at this time when people are not courageous enough to stand for the truth.
Doc Tony, the only other doctor I can think of that has a large following as well is Doc Willie Ong, and he ran for public office. Do you have any plans to run for public office in the future?
No.
Not at all?
Not at all. I'm not using this as a platform for a higher post or running for politics, no. I'm just doing this because I think I can add value to a lot of people.
Have you ever considered that it would be more effective for you to help people if you were in public office?
Magulo eh. It's a different world eh. A different world eh. But that's my answer for now. I cannot predict the future. But at this point in time, I'd rather be a health reform advocate rather than be a politician.
What's an important health advocacy for you right now? Apart from, of course, now you're guarding the PhilHealth fund so that you secure it for the members. You obviously take strong positions on issues that would affect the Filipino people when it comes to health. What's another important advocacy for you?
I want people to live longer, Filipinos longer than 80 years old. Kasi ang lifespan ng Pilipino, 72 eh. We're the lowest in terms of life expectancy in Southeast Asia, Japan, the longest, 85. Above 80s, Singapore, Thailand, Malaysia, Hong Kong, and Macau. People are dying because of our poor healthcare system. Ang pangit ng ating healthcare system. Very poor leadership as well. Yan ang PhilHealth, ninanakaw pa. No? Ang reason for that, tatlo eh. Kung bakit mababa. We're the #1 exporter of nurses in the world. Second exporter of doctors in the world. We have a very problematic PhilHealth issue, and the infrastructure for health in our country, kulang na kulang ang hospital. So, that's the problem that we are facing. That's why mababa. So, personally, I would like to advocate na sana, ang dream dapat, may metrics tayo. We cannot manage what we don't measure. And when I watch the Netflix, How to Live to 100 by that Wetter, there are certain things that can actually make Filipinos live longer. And based on that, on 5 areas of the world, Okinawa, Japan, Sardinia, Italy, Loma Linda, and California, you have Costa Rica, no? So these are countries na mahaba, and lately Singapore. They call it the blue zone, areas where people live to 90 to 100. They found out the following things. Mobility. So you exercise daily, #1. #2, people should have a higher sense of purpose. #3, 80% full. Hara Hachibun, Okinawa. You should not overeat. Dapat kung 80% okay ka na. 5, plant-based diet. 6, find the right tribe. And then family first. Yun ang isa. And then ang panghuli, community-based approach work. Yun ang that's why these people okay lang sila. So I'm trying to advocate this on a daily basis so that people will live longer than 72. Kasi you can actually I want to live up to 84 kasi I have 2 apos. And I projected already that when Simi, my first apo, college graduate, I would be 83. And kung yun naman second, then I will be around 90. Jimmy Carter will turn 100 on October 1.
Wow.
And I read that the reason why he's still living right now because of this street mobility, marathoner pala siya. Peaceful life, he lives in Atlanta, Georgia, a peanut farmer. Higher sense of purpose. He was a better man than a president because he won the Nobel Prize after that for working for peace process and of course working for Habitat for Humanity.
Thank you, Doc Tony. It seems like there is really a formula for living longer. But thank you so much. We learned a lot from you today, and I hope you succeed in your advocacy of helping Filipinos live longer.
Thank you very much.
Being an independent health reform advocate can be a lonely battle at times. But advocating alone or having to face controversies will not deter Dr. Anthony Leachon from carrying on the fight with the determination that his health advocacies shall redound to the benefit of Filipinos. Be timely informed, be insightful of the news. Always stay at the forefront. Join us again tomorrow for meaningful conversations that would help you form an objective personal opinion. This is Attorney Karen Jimeno. Thank you for spending your hour with us.